Hey everybody, it's Brian, physical therapist, and today I'm going to show you a self-treatment technique for the left ear called the Semont technique. This is a posterior canal technique, and basically it's done sitting in the middle of a bed. Now, if I think the dizziness that I have is in my left ear, or I've been told from a provider or had it in the past and it feels similar, I'm going to sit in the middle of the table or bed and I'm going to turn away from the bad ear. Because this ear, the left ear, has to come down on the table or the bed to use gravity to fix the problem with the crystal. So I'm going to rotate my head all the way to the right as far as I'm able to, and then I'm going to come down onto my left side with my chin pointing up to the ceiling. I'm going to hold that position for 1 minute. If I get dizziness, I'm just going to hang on to the bed or table, and I'll have somebody with me just for safety. So it'll look like this. I'm going to rotate, so I'm turning away from the ear that I think is bad, and I'm going to fall down onto the left side on the table. So it'll go like this. I'm going to fall down and bring my legs on the table. And I'm going to hold this position for about 1 minute. So I'm looking right up to the ceiling. My chin is pointing up. I can hang on the table if I need to, or the bed. Okay. So once that minute's up, it's important where our head is positioned for this next part. So your head's going to stay in this position, and we're going to do it basically 180 degrees. You're going to let your legs come off the bed. You're going to push up and go all the way over, now laying on the right-hand side. So you're going here to all the way to the right side with your head staying down. So it's a little scary, but you're going to hang on, and you got to keep it in that position because that's what's going to help those crystals move back where they should be. Okay, so from this position, I'm going to let my legs come up. I'm going to push from my elbow and my hand, and my chin is staying in this position. Now when I come down on the right, I'm going to be looking right down to the ground. So it's kind of like this. Up, and then over. And I'm looking down to the ground. I can keep my head supported as long as I'm looking down to the ground. I've got it grabbing on the side of the bed. I'm just going to do a few little wiggles, about 4 or 5 just gentle shakes, and I'm going to hold for 1 minute. Again, if you're dizzy, if you're dizzy during this, close your eyes, make sure somebody's near you if you need. Once the minute's up, just like the other side, I'm going to let my legs come off the bed. I'm going to push from my hand and elbow. I'm going to dip my head for a second, then come back up. That kind of gets the rest of the debris that might be hanging out in the inner ear. So you push up. I'm going to dip the crystals and then come back to sitting upright. And every time you come back to sit upright,